Hello, welcome back to the channel. Today's news focuses on a heated national debate. Health Minister Motsoaledi has once again found himself at the center of controversy after defending free healthcare for foreign nationals in South Africa. This comes at a time when Operation Dudula and other local movements have intensified their protests, blocking healthcare facilities and demanding that undocumented foreigners be denied access to public hospitals. Please stay tuned till the end to see the sources and verify this news for yourself. Before we get into the details, don't forget to subscribe to the channel and hit that notification bell so you don't miss any of our updates on what's really happening across South Africa. Now, let's break down what's going on. Dr. Motsoaledi, who has long stood by South Africa's constitutional commitment to healthcare access for all, said that denying medical help to anyone, regardless of nationality, goes against both the country's laws and basic human compassion. He reminded the public that hospitals are obliged to treat any person who walks through their doors in need of urgent care. According to him, the oath of medical professionals doesn't include checking someone's passport before saving their life. But that hasn't sat well with many South Africans, especially those aligned with Operation Dudula. In recent weeks, there have been reports of community groups blocking the entrances of several hospitals, claiming that foreign nationals are straining the healthcare system. Protesters argue that local citizens often wait hours for treatment, while foreigners, some undocumented, receive free services funded by South African taxpayers. Motsoaledi, however, insists that the issue is more complex. He says the real problem lies in underfunded facilities, staff shortages, and systemic challenges that go far beyond nationality. He also stated that blaming migrants for these problems won't fix the healthcare system, and that South Africa should instead focus on long-term reforms and better regional cooperation. Analysts say this latest standoff reflects a bigger tension between South Africa's humanitarian policies and growing frustrations among struggling communities. Some warn that the anger could spill over into further divisions if not properly addressed by both national and local leaders. Meanwhile, the Department of Health is urging calling for South Africans to allow hospitals to continue operating without interference. Officials are also in talks with law enforcement to ensure that no violence or intimidation occurs during these protests. As for Operation Dudula, they've promised to intensify their demonstrations if government officials don't take what they call the South African crisis seriously. It's becoming clear that this issue touches deep emotions about fairness, national identity, and economic pressure. Whatever your views, one thing's for sure: the debate around healthcare and immigration isn't going away anytime soon. South Africa's leaders have a big challenge ahead, balancing compassion with capacity. All images used in this report are for illustration purposes only. Sources: Department of Health, News 24, SABC News, and Daily Maverick.